Insulin. So you got to know about insulin. Why? Because every other new grad nurse knows about insulin. And you're going to see patients with diabetes all over the hospital, whether you work in labor and delivery, whether you work in psych, whether you work in med surg, whether you work in cardiology. Wherever you work, you're going to see insulin, okay? I'm not sure that a day has gone by as a nurse where I have not administered insulin to a patient. So you got to know about insulin. So what does insulin do? Well, insulin acts to lower your blood sugar by storing it in your body's cells. You can think of insulin as being a key that's opening up your cells to allow for storage. It's a storage hormone. And, you don't have to know about a lot of different kinds of insulin. I'm going to teach you about 4, but the reality is that I can't think of a time even that I have administered Humalog to a patient or Lantus. Usually it's MPH and regular insulin are the 2 that are prescribed most commonly in the hospital. So, regular insulin. When you're thinking back to nursing school, you saw those diagrams of all the different kinds of insulin and all the peaks and onsets and durations and all that of the different types of insulin. They lay them all over each other, and you have these roller coasters that all overlap. Just disregard that in your head, okay? You really need to know about regular insulin and NPH. The onset for regular insulin is about an hour, all right? You're going to have it peaking in 2 hours, and the duration is going to be about 4 hours. It's not going to be acting in the system much longer after 4 hours. So 1 hour, 2 hours, 4 hours, which is why a lot of times in the facility you'll see blood sugar checks, AC and HS and 3 a.m., or you'll see them Q4 hours. Why every 4 hours? Well, because that's how long regular insulin lasts and acts in your body. Regular insulin is clear, and you can drip it IV. Right? So it's clear and you can drip it IV. NPH, right, has an onset of about 6 hours. So it kicks in later. It peaks in about 8 to 10 hours, and it trails off about 12 hours later, which is why you'll typically see NPH prescribed Q12 hours when you're at a facility. Right? NPH is cloudy. So you want to make sure that medicine is evenly distributed. So to do so, you don't want to shake it or agitate it. You do want to roll it. You want to roll it between your hands to make sure that the medicine is equally mixed. Now, let's look at these numbers. Instead of remembering all those roller coaster stuff, look at what you just wrote down. You wrote onsets at 1 hour for regular insulin. Look from left to right. 1, 2, 4, 6, 8 to 10, and 12. 1, 2, 4, 6, 8 to 10, 12. So I show these people this at the hospital all the time, and while most nurses are giving insulin every day, they don't necessarily think of it in these terms. So that's some logic that you can use to understand the peaks, the onsets, and the durations of the insulins that you're prescribing. And it's also something you want to be teaching your patients also. Now, for Humalog, Lispro is a fast-acting insulin. Onsets in 15 minutes, peaks in about 30, and lasts about 3 hours. Okay. And this insulin you can give in an insulin pump, and you do not give this with meals. This is something that is usually used as like a baseline insulin being administered through a pump. Lantus, also known as Levemir or Glargine, it onsets really slow, and there's really no peak to it. It just lasts anywhere from 12 to 24 hours, depending on patient's metabolism. So, slowly absorbed, duration 12 to 24 hours for Lantus. A couple things you want to apply to all insulin. You always want to check the expiration date. So, always check expiration date. Refrigerates is required before opening, but not after. And This isn't necessarily what you're going to see in the hospital. I know at my facility, we always keep the insulin in the refrigerator. And you can teach your patients to refrigerate all insulin. It's not going to hurt to have it refrigerated. It's going to help it last longer before you open it, and then it lasts about 30 days after you open. But teach patients to refrigerate all insulin. You want to teach patients that exercise potentiates insulin. So increasing exercise decreases the amount of insulin that you need. So potentiate means it accentuates. It does the same thing as insulin. So exercise potentiates insulin. So the more patient exercises, the less insulin they need, which is why we teach them to be active, but also they may need to adjust the amount of insulin that they're taking based on the amount of exercise they're doing. For patients on sick days, you want to make sure you teach them to stay active. And they do want to take their insulin and sips of water as best they can if they're sick to stay hydrated, right? Because being sick, that stress increases your blood glucose level. So they're still going to want to take their insulin, even though they may not be eating as much. Their blood sugar is still going up. And then the other insulin you may see is Humulin, which is a mixture of 70% NPH and 30% regular insulin. Now, rules for drawing up and administering insulin. You always want to draw up the regular insulin first and then the NPH second, right? So you want to roll and not shake the NPH, as we mentioned before. You always use an insulin needle. And if you can't remember which one to draw up first and which one to draw up second, remember that you're going to become an RN, right? You're going to become an RN. And R gets drawn up before the N. Just because you're an RN, R gets drawn up before the N. So let's do some critical thinking about insulin. You're going to typically see a couple of different orders for when to check somebody's blood sugar and subsequently administer the insulin if required. What you'll typically see are a couple different orders. One, you might see Q4 finger sticks and insulin coverage. You're going to see these on patients who are most likely either NPO or people who are receiving tube feeds, where they're having a continuous infusion or periodic infusion of food. So their blood sugar is going to remain a little bit more steady because it's a continuous administration of food, as opposed to you or I, who's going to be eating meals at certain times and snacks at certain times. So that's Q4 finger sticks. Now, what is that? Why would they choose Q4? Why not Q6 or Q2? They choose Q4 because, remember, think back to our regular insulin. What is the onset, the peak, and the duration of regular insulin, right? Well, it onsets at 1 hour, peaks at 2, and is pretty much gone by 4 hours. So that's why we're going to check them and re-administer insulin every 4 hours if necessary. All right, so that's a little bit of critical thinking that you can use when you're taking your exam. Say you forget that regular insulin wears off after about 4 hours. Well, you can just remember, typically you're going to see Q4 finger sticks for patients who are NPO. Now, instead of Q4, you might see where you're supposed to check that patient AC and HS, right, before meals But think about this. How much time is there between breakfast and lunch? About 4 hours, right? How much time is there between lunch and dinner, or between dinner and bedtime? It's about 4 hours. So this is going to coincide well with patients who are eating by mouth. So, and the other thing that you may see, if a patient is having something that's affecting their blood sugar aside from their food, so say something like a steroid, or if there's something else metabolically that's going on that's influencing their blood sugar, say they're not typically a diabetic, but because something about their disease process has caused their blood sugar to get out of whack a little bit, instead of Q4 finger sticks or AC and HS, you might see something like AC and HS and 3 a.m. So that way you get some coverage through the middle of the night, even though they're not eating. If something else is causing their blood sugar to increase other than food, That's why you want to get that 3 a.m. finger stick. And that's something that's going to be in the physician's orders, but it's just a little bit of critical thinking to help you wrap your head around insulin and why we're giving it, when we're giving it. The last thing, critical thinking-wise, is, and it makes sense, based on what we've just learned, is that when you see NPH orders, they're typically going to be Q12. Right? So you're going to give NPH twice a day. Well, why is it twice a day? Why is it every 12 hours? Because think back to how long it lasts in the body. It's going to it's going to onset in 6 hours, peak in 8 to 10, and be gone by 12 hours. So that's why you're going to give it Q12. So these are some strategies and some techniques that you can use to totally dominate insulin questions on the NCLEX. If you don't study any other drug, you got to know your insulin, okay? Especially regular and especially NPH. Most people don't know about Humalog or Lantus, so make sure you know your regular, make sure you know your NPH, and you're going to do well in the NCLEX.